So today we are going to discuss the antibiotics drugs. By the end of this lecture, you will be able to identify different classes of antibiotics, describe the classification of antibiotics and their prospective mechanism of action and resistance. In this, the factors leading to the failure of antibiotics therapy. So in antimicrobial is any agent that whether it's natural, semi-synthetic or synthetic, that kills or inhibit the growth of microorganisms. So microorganisms can be bacteria, fungi, or antibiotic or viruses. So these drugs selectively target these microorganisms, but it has little or no effect on the host cells. So we want the drug to affect only the microorganisms. So based on the differences between the cell membranes or the proteins in the microorganisms and the humans, the drugs are designed to be specifically inhibiting the proteins or the membranes or the cell wall of the microorganisms, due to which it has little damage or no damage to the host cells. These are different terminologies used for the inhibition, like MIC is the minimum inhibitory concentration, which is the lowest concentration of antibiotics that inhibit the bacterial growth, while MBC is minimum bactericidal concentration, which is the lowest concentration that kills the bacteria. So we have two terminologies, we will discuss that later on, bactericidal and bacteriostatic. So what is bactericidal? Bactericidal is the bactericidal drugs are those which actively kills bacteria, while bacteriostatic drugs are those that inhibit or delay the bacterial growth and replication, but does not otherwise kill them. So you can see from these diagrams, in reality there is no sharp distinction between the two, as some antibiotics can be both bacteriostatic and bactericidal depending on the dose, duration of exposure and state of invading bacteria. So it can depend on the dose, like some drugs are bacteriostatic at low concentration, but they can kill the bacteria at higher concentration, or depends on the duration. In small duration, if you're using for short duration, it can inhibit the bacterial growth, but in higher or longer duration it can kill the bacteria. For most infection, bacteriostatic and bactericidal antibiotics inhibit or kill organisms at the same rate and should not be the factor in antibiotic selection, but in some situations traditionally we are preferring the bacteriostatic bactericidal over the bacteriostatic drugs, and that are basically complicated situation like endocarditis, meningitis, osteomyelitis, neutropenia. So in these cases, these are even fatal situation which need proper or sudden killing of the bacteria within these organs. So bacteria can be classified on different ways. One of them is the composition of a bacterial cell wall. So gram-positive bacteria are those which have a thick peptidoglycan layers in their cell wall, while in gram-negative bacteria they have very small glycopeptidoglycan layers. So that is the main difference between the gram-positive and gram-negative bacteria. You might have discussed this in detail in your microbiology, so here we will not go into the details of these. Now these are the factors which determines the antibiotic selection, like the organism identity, which type of bacteria is causing the infection, and based on the identification of the bacteria, proper antibiotics has to be prescribed for that proper antibiotic. Sometimes the physician are starting empirical therapy, that is the starting of the in empirical therapy, the the antibiotics are immediately started or administered prior to the bacterial identification and susceptibility treating. So it depends on the condition. In some conditions you don't have to wait for the test to come and then prescribe the medication, or based on the symptoms the doctors can prescribe the antibiotics without waiting for the test, specific test for the specific bacteria. Determine antimicrobial susceptibility of infective organisms. So based on the, we have to describe, determine the antimicrobial susceptibility of infective organisms. Sometimes we are preferring bacteriostatic and bactericidal, but mostly it is not. So then we have to look whether bacteriostatic or bactericidal is more preferred in these conditions, or sometimes we need to have a specific or broad spectrum antibiotics. So these are the other factors that are also playing an important role in selection of the antibiotic drug, like concentration of antibiotic at the site of infection. We have to make sure that the drug reaches to the site of infection. We have to look for the distribution, metabolism, and excretion rate. Also, if the patient is taking any other drug, whether that drug is interacting with these antibiotics or not. Like the blood-brain barrier has to be considered, whether if the infection is in the CNS, the drug has to cross the blood-brain barrier. Other factors like include the patient-specific factor like age, renal and hepatic function, blood perfusions, drug allergy, pregnancy, and lactation. So all these has to be taken into considerations. Safety of the agent is important, and the cost of therapy. So if we have a drug that is lower in cost and have the same efficacy with the other drug that is more in cost, so we have to select the drug which has low cost as compared to the drug which is more expensive. So we have to look into the socio-economic background of the patient as well. Antibiotic resistance is one of the main issue with the antibiotics use. So that's why antibiotics has to be used with caution, and it should not be misused. So how the antibiotics for the bacteria produces resistance to different drugs. Like for penicillins, some bacteria can produce beta-lactamase enzyme which inactivate these penicillins. We will discuss this in the coming lecture for different drugs. In some cases, the alteration of the drug binding site is mutated, like the bacteria mutate or alter the drug binding sites, and the drug then unable to bind to its site. It can reduce the uptake of the drug by changing the bacterial cell wall or cell membrane, or it can alter the enzyme pathway through which the drug acts, like trimethoprim. This is one of the enzyme that deactivates the dihydrofolate reductase enzyme. So these bacteria can change the pathways for these enzyme formation, and the step which is inhibited by the specific enzymes that can be bypassed. So then these drugs become inactive to the bacteria which have changed the enzyme pathway by which the drug was acting. So these are the superbugs, microorganisms with multiple resistance, which have evolved resistance to most of the antibiotics. Like this methicillin resistant Staphylococcus aureus. So this is methicillin or oxacillin resistance. They have evolved resistance to this. Visa vancomycin intermediate resistance stain resistant Staphylococci, or PRSP. This is penicillin resistant Staphylococcus pneumoniae. They have evolved resistance to some of the antibiotics. That's why they are called superbugs, or with multiple resistance. So with time, if you can see, the level or the invention, the discovery of antibiotics is decreasing, while the resistance to antibiotics is increasing. And that is a dilemma, and it can lead us to the pre-antibiotic era where small infections were unable to treat. So that's why there is a need to properly use these antibiotics and overcome the resistance that is constantly increasing over the years. Like if you can see the example, this is the Staphylococcus infections were cured 100% in 1952 by the penicillin. But in 1982, only 10% of the infections can be treated by by penicillin. So nowadays, MRSA causes 19,000 deaths annually in the USA. So this is the situation of the bacterial resistance. And as you have seen in the previous slide, due to increased resistance in the antibiotics, we should carefully use antibiotics and should not be used without any proper cause. There are certain, in fact, in cases where we can use antibiotic prophylactically, and these are like dental procedure, which can lead to bacterial infections. In case of patient with a history of rheumatoid diseases, so these patients are more prone to have staphylococcal infections. So that's why these patients are given prophylactic antibiotics. In case of pre-treatment, may prevent the tuberculosis or meningitis among individuals who are in close contact with infected patients. So some patients who are normal but who have become in close contact with other patients who have these pneumonal infections, so they are prone to have bacterial infection. Similarly, in surgical procedures, after surgical procedures, in order to inhibit any infections, or in case of HIV, some treatment, some drugs like zidovudine, this can protect the fetus in the case of HIV infected pregnant women. So these are the cases where we can prophylactically use antibiotics. Misuse of antibiotics leads to resistance. That's why we should not misuse it. Treatment like normally in these cases, antibiotics are misused, like treatment of insensitive infection or viral infection, treatment of fever of undetermined origins, treatment without any adequate bacteriological data, or improper dosage. So all these misuses can lead to bacterial resistance, and in this condition, bacteria should not be used. Improper dosage, this is very important. If you have started antibiotics for any bacterial infection, please do complete the proper course. These are the factors which can lead to the failure of antibiotic therapy. So these factors can either be patient-related or pharmacological failure related to the spectrum of the drug, or related to the microorganism. So patient-related, when the patient is not properly compliant, he is not properly taking the medication, like improper dose, taking less amount of dose, that can lead to failure of the antibiotics, inappropriate administration route, or immunodepressed host. So in some patients who have immunodepressed, that can also lead to antibiotics failure. Pharmacological failures, inadequate coverage, some drug-drug interactions. So some drug can interact with the antibiotics and they can inactivate the bacteria. So you will be taking the antibiotics, but it might interact with the other drug that the patient is taking. So that will inactivate the drug. Or inadequate coverage, the antibiotic is not properly prescribed for the specific agent or from the specific bacteria. Microorganism related wrong pathogens resistant acquired during treatment. So sometimes if the resistance is acquired by the bacteria, then the bacteria will, then the antibiotics will not be able to work. Insufficient bactericidal activity. Some drugs are insufficient. So these are the drugs which needs to be uh, now classification of antibiotics. Bacteria can be classified based on the chemical structure, the mechanisms, or the spectrum of action. So chemical structure, like different drugs belong to different class, chemicals class. So based on the chemical structure, they are classified into group of sulfonamides, beta-lactams, aminoglycosides, tetracyclines, macrolides. So group of polyenes, polymyxins, quinolones, other group like vancomycin. So these drugs belong to these. You don't have to memorize which drug belong to which drug, but the main mechanisms that you have to know, that which drugs affecting which part of the bacteria, like here, based on the mechanism of actions. This is more important to know. It's like some drug interfere with the cell wall synthesis. So beta-lactam, vancomycins, these are causing the inhibition of cell wall. Some drug interfere with the nucleic acid synthesis. So inhibition of the nucleic acid synthesis, like rifampicins, quinolones, interference with the protein synthesis. We will discuss these drugs in detail. Tetracyclines or aminoglycoside, macrolides, or cell membrane synthesis inhibitor like polymyxins. We will discuss this in this lecture series. Based on the spectrum, we have narrow spectrum big antibiotics or broad spectrum. So narrow spectrum antibiotics are those which are effective against gram positive or gram negative only. So they have specific target, while broad spectrum, as the name indicate, these are effective against a variety of microorganisms, including gram positive, gram negative bacteria, mycoplasms, and some protozoa. So these are the examples of the narrow spectrum drug and broad spectrum drug, like penicillin, except the extended penicillins. We will discuss that later on. First generation cephalosporins, erythromycins, polymyxins, these are narrow spectrum. While the chloramphenicol, tetracycline, second, third, and fourth generation of cephalosporins, third generation cephalosporins, these are all broad spectrum antibiotics. So in this lecture, we have discussed the antimicrobial drugs, the definition of antimicrobials, NIC, minimum inhibitory concentration, and minimum bactericidal concentrations, factor in the antibiotic selections, or what factors has to be taken care during the selection of antibiotics, prophylactic use, in which situation we can use it prophylactically, and misuse of antibiotics, the situation where the antibiotics are misused, and resistance, the mechanism of resistance, and the classification. We can classify these antibiotics based on the chemical structure, mechanism of action, or spectrum of their activity. So that's all about the antibiotic, introduction to antibiotics. In the next lecture, we will discuss the different types of antibiotics based on their mechanism of action: cell wall synthesis inhibitor, then the protein synthesis inhibitor, or nucleic acid synthesis inhibitor. So that's all.